Hey guys, Dr. Hampton here, board certified obesity and family doc here with Dr. Vyvyane Loh, who's also an obesity doc and internist. And we have something in common. And that one thing in common is that we've both had problems with our gastrointestinal system, which is why we decided to change our lifestyle to correct it. So if you're suffering from gastrointestinal problems, particularly irritable bowel, this is a great video for yourself and any family member who may be suffering as well. It's really important that we learn the secrets to being healthy. And it's very difficult for us clinicians to do our job. And it's very difficult for you to do your job and be healthy for your family if your stomach is driving you crazy all the time. So, Doc, we've both had problems in this area and we both have fixed it. My question is, how in the heck did we fix it? What did you do?
Well, I'll tell you what I did. It started with a patient of mine who told me that she was going to go on a low carb diet. And this was a long time ago. And she asked me if I knew anything about it. And I was very honest. I said, no, I don't. But I said, hey, why don't I do it with you? And I thought, if she's going to do it, maybe I should find out what she's doing. So I said, look, let's just do it together. And she was rather surprised, but she said, okay. And that weekend, I started, kind of worked through my diet and cut out all the carbs. And I was going to do it over the weekend and just get a sense of what it was like. But by the time the weekend was over, all my irritable bowel symptoms were gone. And then at that point, I was really afraid to add any of the carbs back. At that point, I was like, wait a minute, because I thought that this was something I was born with. I just had to deal with it. And, it's just one of those things. And then when I realized, wait a minute, I have never felt so good. Why is that? And then I was really scared to add the carbs back. And that really was the start of how I became, sort of a low carb fan.
Yeah, and I'll say the same. I've had the same experience, and I can't remember how quick it was, but I do know that when I cheat, I'm good for a few days. So whenever I take a trip, for example, I try to be careful not to overdo it. So I think we're all kind of people who suffer from this will always have a little bit of a vulnerability. But I tell you, I can cheat and be just fine. But there's no desire to cheat a lot because I enjoy the food. I like steaks and all the animals I eat. I love non-starchy vegetables. In fact, tonight I'll be eating some cauliflower mac and cheese. And I love that, all the fat and heavy cream and butter I like, but yet it doesn't bother my stomach. So it's really important that, people who are suffering from problems like irritable bowel, inflammatory bowel, the answer may be in the diet. And any reasons why you think the diet works so well? Like, what does it improve? What have you seen in your practice in terms of what it actually helps?
Well, I think first and foremost, we cut out all the processed foods, right? What all the chemicals, and we're going back to foods of one ingredient, right? Chicken, chicken, broccoli,
Yes.
broccoli, one ingredient. So I think that in itself already is a big help. And then because when you cut out the carbs, you tend to see less of the bloating. You tend to see less of the distension that symptomatically really helps the patient. It also helps correct the gut microbiome. So a lot of people come to me with dysbiosis and they have overgrowth of the bad, bacteria in their gut. And so, clearing that away when you get rid of processed foods and also the complex and starchy carbs, it can be very, very. It can actually work very quickly for a lot of people. And then finally, when you do go into ketosis, for some people who go low carb enough to go into ketosis, the ketones themselves have anti-inflammatory action, so that can help with inflammation throughout the body.
I love it. And I have experienced that, and I agree. People shouldn't be afraid of low carb or keto because less inflammation. For those who've heard of the term leaky gut, the guts, the lining's healthy, so all the bad things don't get absorbed into your gut and increase your risk for autoimmune diseases. Your risk for metabolic syndrome is going to go down. Your microbiome, which is the bacteria that you want in your gut, all those things correct themselves simply with your diet. And if we just want to live in a world, which is why we're messaging this, where our clinical colleagues are aware so they can at least have a conversation with their patients, and their patients who are listening can have a conversation with their clinicians. Maybe I can try this. And I really appreciate that you actually did it with your patients. So that's some true dedication. So I appreciate you, Dr. Loh, for being here. And for those who are listening, Dr. Vyvyane Loh was a guest on podcast episode 54, and I'll make sure to have a link to that episode in the show notes. I appreciate you guys checking out my channel. Make sure to like, subscribe, and of course, comment as appropriate. In fact, share your story. If you have issues with your gut, share what your issues are, and if you've tried a low-carb diet or a keto diet or even intermittent fasting to heal it. So I thank you again, Doc, for being here. And for those who are listening, be safe, be well, and continue to protect your nest.